It is for me a great pleasure to be able to welcome a very, I won't say old friend, but I'll say a very dear friend. Philip and I have been friends for more than 3 decades. We both made our first trip to Asia together at the same time. I was a journalist then. I won't say what Philip was doing at that time, but we both have passed through a lot of different changes. And it's especially important now for us to be able to draw on the knowledge of someone that we trust, that we know and trust about something as important as COVID, and also an area that there's a lot of information around that it's hard to tell what's reliable, what's not reliable. And I will try to stop calling him Philip and say Dr. Rix. Dr. Rix has a PhD specializing in epidemiology and in public health. He worked for the WHO, the World Health Organization. He's worked in Europe on projects for AIDS, HIV. He's worked in Africa on the Ebola epidemic, and is just an incredibly competent and knowledgeable person. And in the case of COVID-19, we have a special opportunity to learn from his experience because Dr. Rix was part of the first team that was observing the development and actually detecting it as an international threat last year on behalf of the Center for Disease Control in Atlanta, Georgia, where he's now working. And I am just going to turn it over to Philip. We have lots of questions that we've gathered from the community. We'll save them for the end.
Okay.
Now we just let you educate us.
Okay. First of all, I just want to say how thrilled I am to be here. Yeah, Damcho, it's been a lot of things that we've gone through together, but we always seem to be on this path together. Always, you know, whatever's happening in one of our lives seems to somehow be happening in the other one's life at the same time. So truly a spiritual sister from not just this lifetime. So I'm really glad to be here and to be always sharing this journey with you. So I'm going to give an overview about coronavirus. I'm going to try and keep it to like 30 minutes and then take questions. So I'm going to start talking first a little bit about what is a coronavirus, some of the background about coronaviruses in humans, what you should do to stay safe and healthy, how to talk about people who may be at increased risk, how to take care of other people, and sort of wrap up with the idea of how to take care of yourself and how to take care of other people. So I just want to first start off talking about coronaviruses, a large family of viruses. They are found in humans, they are found in many animal species, in dogs, monkeys, bats, birds, snakes, cats, dogs. And sometimes they actually can cross between different species. In humans, there are 7 types of coronaviruses, 4 of which cause basically mild common cold-like symptoms, and then 3 that are very severe. The first one that I think people know about is SARS, which was back in 2002. It started in Hong Kong. Then there's something called MERS, which is Middle Eastern Respiratory Syndrome, and it comes from camels, and it's mostly in the Middle East. And now we have this SARS-CoV, what's called SARS-CoV-2, because it is very similar to the original SARS virus of 2002. So this is the second one. And the illness is called COVID-19. So sometimes people mix those things up. Like most coronaviruses, it is spread by person to person. This is the main way that it is spread. It's spread because it gets into the air if you cough, if you sneeze, if you're singing. This is one of the reasons that we have concerns about people going to churches and singing along during services. So it gets into the air and it gets into your nose or it gets into your mouth, or it gets onto your face and you rub it into your eyes. And this is the primary way that it's transmitted. Now, it can be transmitted because you sneeze, you cough, or it gets on a surface and you touch the surface. So, how long does it survive in the air? It survives in the air. I wrote this down now. Let me find where I put that. It will stay in the air about 3 to 4 hours. It can just hang in the air for about 3 to 4 hours. But remember, we're talking a closed space, like a real laboratory space. So if you're outside, it just dissipates. The wind blows it away. A lot of the times, actually, if you know anything about air and you move towards something, you actually sort of push things away from you because the air in front of you pushes it away. So, if you are normally, things are suspending in the air, if you're outside, it's not such a great risk. This is one of the reasons that we ask people to wear masks, so that you don't put it into the air. This is what the mask really does. So you cover your face, it doesn't get into the air, no one can get infected. But I want to talk a little bit more about that. Yes, you can get it by touching a surface that's infected. How long does it last on different surfaces? Maybe it's up to 4 hours on copper. On cardboard, we think maybe up to 24 hours. Plastic and steel, we think maybe 2 to 3 days. So that's how long it can survive on the surface. Now, that doesn't mean one little viral particle is going to make you sick. So these things, you have to take with a sort of degree of, or sort of range here. Let me tell you how it is not spread. It is not spread through water. We have not found any evidence that it's spread through drinking water, through standing water, through pools. We are concerned that it could be vaporized, so perhaps a sauna is not such a great idea. But drinking water, standing water, we don't have evidence that it's transmitted through this. We don't have evidence that it's transmitted through food. So normally cooked food is really not an issue. If you think about it, you put food into your mouth, which then gets attacked by saliva. This is really not a great way for a virus to sort of infect you. It's better for it to get into your nose, for you to inhale it and it gets into your lungs, because this is what it does. It's a respiratory illness. Most coronaviruses normally affect young people and the very old, but with COVID-19, we sort of have seen a bit of a difference here. So like I said, so I want to talk a little bit about this COVID-19. Where did it start? Where did it come from? So the first cases were detected in Wuhan, China. This was at the end of December. It was a small cluster of cases. These were associated with an animal market where there were live animals. And so in the beginning, we thought, yes, this is something that went from animals to human. And then slowly, as more and more cases came out, we realized that, you know what, this is actually transmitted between people and not just from animals to humans. The first case outside of China, I think, was January 13th, and the first case reported in the US was January 21st. Now, I know a lot of people have said, is this a natural virus? Is this a man-made virus? I know all the lots of theories about this. Let me say, from all of the evidence we have, this is a naturally occurring virus. Viruses, let's just say this, life is kind of messy, and so is genetic material. There's kind of junk in a lot of our genetic material. Our DNA has a lot of stuff that's just, we don't even know what it's for anymore. It's just kind of, doesn't really code for anything. It's kind of junk. And so, but if you have a man-made virus, it tends to be virus. It looks like the previous SARS virus that we have. It looks similar to the coronaviruses that we've detected in bats. We think that, a lot of the evidence is this is very closely related to bats. We can't confirm that, but seems to be very closely related to a bat species. This is a naturally occurring virus. This is not something that was made in a lab and just released into the environment. Again, as I said, it's spread mainly from person to person through droplets. I know people have asked questions about, in terms of it being transmitted, there's a lot of concern for new mothers and children. And is this virus transmitted through breast milk? And all the evidence that we have to date says no. Breastfeeding is very important for children. It provides antibodies to a lot of things that they haven't developed yet. It provides nutrients. It's the best source of nutrition for a baby. So we feel that breastfeeding is not a risk for children if the mother has COVID-19. Now, if the mother has COVID-19, she does need to be careful about washing her hands and about having a face mask on when she's around the baby. But breastfeeding, we don't feel is a risk for babies. And the decision should be made between the mother and the doctor and the family in terms of what is best. But so far, there's no evidence that is spread from breastfeeding. And so I really wanted to clear that up because I know that a lot of people have questions about that. So what are the symptoms of COVID? It looks like the flu. You have fevers, you have chills, headache. This illness is known for really affecting sort of the upper respiratory. So you could be shortness of breath, a tightness in your chest. You could be tired, you could have muscle aches, and sort of any of the other cold symptoms, a runny nose, a sore throat, cough, congestion. These symptoms normally appear 2 days or so, 2 to 14 days after you've been infected with the virus. So a lot of people call this the incubation period. And this is a period of how long it takes between you getting infected and you actually having symptoms. So this is the incubation period. Now, the important thing about COVID-19 is during this incubation period, so I should say, there's also what we call when you're infectious, when can you spread this illness? And normally it's when you have symptoms. Normally it's when you have symptoms that you can spread it because you're coughing, it's coming up through your saliva, and so you can infect people. However, with COVID-19, we think that people can transmit it before they have symptoms, usually 2 to 3 days before they have symptoms. This is why this mask wearing is so important, because you can't just say, oh, I'm having symptoms now, I'll put on a mask. You may have it and not be having symptoms, and then you're coughing and you're talking to people and you're near them and you're spreading it. Not intentionally, I mean, you just don't know. And this is why it's just so good for everyone to wear a mask and to practice all the other precautions and safety guidance that we have about this. There are some moments when, if these things happen to you, you should seek care immediately. If you have real trouble breathing, if you've been sick with COVID and you have real trouble breathing, you should call for healthcare. You should call a doctor, a nurse, maybe you need to call the hospital. You need to let people know that you suspect you have COVID-19 so that they can be ready for you to come. Especially if you have a pain in your chest, this is a real indication that you're having really difficulty breathing and this is respiratory distress. This is what we worry about COVID-19. People become so ill, they need respirators. Respirators are a really life-saving measure. We don't want people to get on respirators. So if you start to feel pain in your chest, you should seek medical care. If you start to feel confused, you know, if you are around a friend or family members and you notice that this person was ill and they weren't well, but now they just seem really confused. They can't remember things. You need to seek some help. If people suddenly are not able to stay awake, they're losing consciousness, this is another warning signal that you need to seek medical care. Also, especially if people start to turn blue in the face, it means that they're not getting enough oxygen. And that's a real serious condition. So if any of those things happen, seek help immediately. So as I said, it can be a mild illness, it can be very severe illness. Now, most people who have COVID-19 will recover just fine. We think of, 2% mortality. Okay, that means 98% people recover. So most people will recover from COVID-19. Most people will have a sort of a mild illness. You can stay at home and take care of it. But it can be severe. You can have pneumonia, you can have respiratory failure, you can have multiple organ failure, you can have kidney damage. So it can become very severe. And I will talk a little bit more about people who are at increased risk now. So who is likely to have some of these very severe complications? People over 65. So if you live with your grandparents or you live with your parents who are over 65, these are people who are at increased risk for really severe outcomes. Here in the United States, I think 85% of deaths are in people over 65. And I want to say 70% of hospitalizations are in people over 65. And the older, the worse the outcomes tend to be. So people who are older really need to practice all of the precautions to stay healthy. And the people around them, even more so, need to practice the precautions. This is why we talk about wearing the mask, social distancing, washing your hands, covering your cough or your sneeze. It's so important for the elderly that if you don't do it for anything else, you do this for your parents and your grandparents and your elderly aunts and uncles, because they are very susceptible. Other people who are at increased risk, people who have diabetes, people who have obesity, people who have lung illnesses or heart conditions. These are people who have asthma. You have moderate to severe asthma, and I know a lot of people have that. That's a very serious condition. If you have any chronic conditions, the first thing that I want to tell you is whatever medications you are on, stay on them. Do not change any of your medications because of COVID-19. If you think you need to change your medications, you talk to your doctor. People who are at increased risk of illness, you probably need to take some extra precautions. You should be sure that you have at least 2 weeks of medicine. If you can get more of a supply, be sure that you have this on hand so that if you get ill, you have your regular medicines. Be sure that your vaccinations are up to date. If you have any of these underlying conditions, if you have diabetes, if you have any treatment for, if you have treatment for cancer, so if your immune system is compromised, you want to be sure that your vaccinations are up to date. All your childhood vaccinations. And for people over 65, there are other vaccinations that people recommend. Now, we are going to have flu season coming in the fall. So one recommendation is for people to get the flu vaccine, especially for people who are over 65, people who have underlying conditions. You want to have the flu vaccine because you don't want COVID-19 and the flu. These two things together is bad. You don't want to have the flu and need medical attention when COVID-19 is, in lots of cases of COVID-19. You don't want the risk of having to go to the hospital during these circumstances. Getting ill takes resources. It takes time, it takes energy from people, it takes space in hospitals, it takes medications. So whatever we can do to reduce the burden on the healthcare system, we need to do so that people who really do need care can get it as soon as possible. So people who are at high risk really do need to practice all of these precautions very, very diligently. I would say also something everyone needs to do is make a plan. Like, what am I going to do if I get sick? Do I have enough medicines? can I work from home? Who will come and take care of me? Who will clean my house? Maybe you have a pet. Who's going to take care of your pet? Who's going to take care of your children? Talk to your doctor, talk to your family, talk to your friends. Have a support system in place and have a plan. Maybe the whole family sits down and you decide who's going to do what if one of you gets sick. The worst thing that happens in situations like this is you don't have a plan, and then it's kind of chaos, and you lose a lot of time trying to figure out what to do. So sit down. I'm sending some resources, read through the materials, think about a plan for your family, and especially for your elderly parents or grandparents or anyone in your house who may have an underlying medical condition. So I want to talk about some of the prevention measures that I keep mentioning here. So the first one we say is, hand washing. Soap and water is just fine. Soap and water for 20 seconds, washing your hands is good enough. Soap and water works very well at actually killing the virus. The chemical properties of soap actually are very good at killing the virus. So if you use soap and water, that's fine. You could use soap and water to clean surfaces as well. If that's all you have, that's fine. If you have disinfectant, you can use them on surfaces. But washing your hands, after you have taken care of a child or an elderly person, wash your hands. After going to the bathroom, before preparing meals, wash your hands. All of the good hygiene stuff your mama told you about washing your hands, this is the time to do it all the time without fail. Okay, it's really simple. And clean hands cut down on a whole lot of stuff other than COVID-19. I was in, Damcho mentioned that I was in Africa for Ebola, and we were, you had to wash your hands with bleach every time you went into a place and someone put it into your forehead and took your temperature. And, diarrheal illnesses just plummeted in Africa with Ebola because everyone was not washing with bleach. So clean hands are a good thing. Another thing about your hands is really try to avoid touching your face. I think someone did a study, we touch our face, I think upward of 40 times an hour. Just be really conscious of touching your face. You touch surfaces, you touch your eyes, things get into your eyes, that's right into your bloodstream, that's right into your lymphatic system. You rub your nose, you smudge your, things just get in through your hands. So try to avoid touching your face with your hands. That was another thing about Ebola, is that because you were washing your hands with bleach all the time, whenever you touched your eyes suddenly started stinging. So this was like the perfect reminder not to touch your face. So whatever you need to do, don't touch your face. Cover your cough and your sneeze. We go into our elbow if you have to sneeze and you can't get a handkerchief or you can't get a paper towel or something, you sneeze into your elbow to cover your sneeze and your cough. Please teach your kids how to do this. Kids, we love them, but they do carry germs. And they're a little messy. It's part of the charm, but they're a little messy. And so teach your kids to wash their hands. Make it a family thing with your kids. There must be 1,000 songs on the internet about washing your hands. So make your kids sing a song and wash their hands. Make a song about sneezing into your elbow. Make this part of your kids' routine. It's good practice for their whole lives, not just in this situation. We do talk about people, if you can't wash your hands, the hand sanitizers are fine. They should be 60% alcohol. I just want to say that. And careful about these hand sanitizers. Please don't put them near the stove or anything that produces heat because they are combustible. And we've had some instances of that in different countries where that's happened. Everyone is talking about social distancing. Keep 2 meters between yourself and other people, especially indoors. Generally at 2 meters, things that aerosolize are probably not going to impact you as much as if you're right there in someone's face. It makes it so much easier. 2 meters allows for there to be dispersion if someone does have the virus, so that you are at less risk for inhaling it and getting it into your system. But once again, this is where we talk about having face masks. Face masks, they can be made of cloth. There is a resource that I have attached for you on how to make a face covering. It can be out of cloth. You can use different materials. There's information on how to wash them. You can wash them like you wash normal things. But wearing a face mask is very important. And a face mask has to cover your nose and your mouth. And there's also instructions about taking them on and putting them off. You put them on with the ear holders, you put them on, but what do you do before you put them on? You wash your hands. And after you take them off, before you take them off, you wash your hands. And after you take them off, you wash your hands, because all that time, that mask may be getting stuff on it. And you don't want to have it on your hands after you take your mask off. And now you got your hands all dirty, and then you put your hands on your face. So this is what I'm talking about. Washing the hands is like breaking the cycle. So every time you wash your hands, you are helping to break the cycle of transmission. Every time you have your mask on, you're helping to break the cycle and keep people safe. So please do this at all the times. Talked about how to put them on. You can wash them in the machine. You can put them in the machine, depending on what material they're made of, in the washing machine. You can dry them outside in the sun, that's fine, or in the dryer. Also, cleaning surfaces in your household. We all have keyboards, we all have mobile phones. You need to clean these often. The surfaces in your home that you touch often, doorknobs, light switches, the light switch on your bed lamp, tabletop surfaces, especially your keyboards, your phones. Walk around the house with a little spray bottle of water, soap and water, and just spray everywhere you touch, and you need to do this consistently. And I have concluded some information on like how to clean your house, what types of products you can use, if you don't have a disinfectant, what you can use in its place. So this is another very important thing for people to do, is to keep the environment clean, because like I said, you can touch something, someone sneezes on your keyboard, and then you touch your keyboard, then you touch your face, and you've got it. So cleaning surfaces is very important. People ask about going out in public. Whenever you go out in public, I would say you should have a mask on. If you have to go to the grocery store to go shopping, which all of us have to do, have a mask on. If you have to go to the pharmacy, have a mask on. If you have to go to the bank, have a mask on. People going to work, if you cannot social distance at work, you should have a mask on. It's just really very, very important not to be sharing your communal space with other people as much as possible if you have to go to work. This is very, very important for you to do. And so I want to talk a little bit now about what do you do if you're sick? What if you start to have symptoms and you think you've got COVID, and maybe you have a friend who was sick and you know that they had COVID and you were around them, and okay, so you didn't have a mask on. Okay, you've been exposed. If you can, stay home. Stay home. And stay and isolate from your family and the people that you live with. Be sure that you always have a mask on when you're around them or when they're around you. If you can stay in a separate room, stay in a separate room. Do not eat with your family because, of course, you take off your mask. Don't share plates, cups, saucers, knives, forks, utensils. Do not share any of that with your family. You should have your own set that gets washed and cleaned. Be sure that whoever has to clean around you tries to have on gloves to clean. And if you have a separate bathroom that you can use, you should use only that bathroom, and you should be the person to clean that bathroom. As I said, most of us will recover from COVID-19. We'll take aspirin or paracetamol, or we'll take basic over-the-counter drugs that we normally take for colds and flus, and we'll be fine. Stay well hydrated, but be ready to, but again, have a plan that if your symptoms get worse, you have someone to call. Know what the symptoms are. Be sure that your family knows what the symptoms are. Be sure that they know what are emergency symptoms, like you're suddenly disoriented or confused, you're having difficulty breathing, all of those things that I mentioned that you want your family to know about. Right now, we don't have a treatment for COVID-19. So like I said, it's mostly your over-the-counter medications that you're going to take at home. There are some treatments. I know that people have been hearing about these treatments that have come out. Most of these new treatments that have come out are for people who are very severely ill. It's not for the sort of mild or general symptoms. These drugs at this point, we don't have things that are a cure or that treat mild symptoms. The drugs we have now are for people who are severely ill. And these drugs keep people who are severely ill from dying, or they lessen the amount of time that it takes for people to get well. But these are not really drugs that are going to be used in an everyday circumstances with COVID-19. So people want to know, should I get tested for COVID-19? Now, depending on where you live, your health department is probably making a lot of different recommendations about when to get tested. Here in the United States, the recommendation in the United States and other places, the recommendation has been you get tested if you have symptoms. So there are two types of tests. There's one that's called the antigen test, and also some people refer to it as the PCR test. And then there's one test that's called an antibody test. So I'll talk about the antigen test or the PCR test. Some people call it the rapid test. This detects the actual virus itself in your body. So if you have an active infection, they will take a swab and they will stick it up your nose and swab your navel cavity, because this is a really good place that the virus likes to live. They will take it, they will swab it onto a plate, and they will look for presence of the actual virus. This is for active infection. So if you have symptoms, that's when you should go and get tested for antigen. Because if you don't have symptoms, you probably don't have the virus. So taking the test is using resources, and it's probably going to be negative. So the normal recommendation is that you don't get an antigen test if you do not have symptoms. Now, if you are in a vulnerable population, if you have an underlying condition, if you're elderly, you're over 65, you talk to your doctor, your healthcare provider, and your health department, and maybe a different decision is going to be made. But that's something that you should think about and discuss with your healthcare provider. But normally, antigen test is for if you have symptoms. So that's the first test. And the second test is the antibody test. The antibody test only tells you if you have ever been infected with the virus. It really sort of tells you, has your body seen this virus? It doesn't, because remember, you could get the virus and not have any symptoms, which many people do. Many people get the virus and they don't even know it. They go about their day. This is again, this concern about why we wear masks, because you can have the virus and we think that without symptoms, you can be transmitted. So this is why it's good for everyone to keep wearing masks until the amount of infection just gets so low in the community. But until then, people need to wear masks. What does the antibody test tell you? It tells you my body has seen this virus. Does it mean that I can't get infected again? We don't know. Does it mean that you have immunity? We don't know. If you have immunity, we can't tell you how long. I remind people, we are in July, so we have really only had 6 or 7 months to learn about this virus. That is a small amount of time. We just haven't had enough time to learn everything we'd like to know about viruses, about flu, we know so much about measles and flu and Ebola and normal coronaviruses and many, many other things that we've had years and decades to study. We've had months to study this, so we just don't know all the answers to these questions yet. And I know people are feeling very frustrated, and it seems like we come out with new information, but it's just evolving very rapidly. So, stay up to date on information. The CDC, the US CDC is a good source of information. They're always updating information. Another great site is the World Health Organization, www.who.int. Go to their site. PAHO has a great site. It's the Pan American Health Organization. It's the Association of the Americas, or WHO. They have great information in different languages. So stay up to date on information. That's an important thing to know. So again, the antibody test only tells you you've been exposed. It doesn't really give you a whole lot more information. What does it mean? It doesn't really make a whole lot of difference. If it was positive, it just meant I had been infected before. Didn't mean I couldn't get infected again. Doesn't mean now I suddenly have super immunities. So people keep saying, when is this going to be over? This will be over when we have a vaccine. So yes, it may be over when we have a vaccine. Let me say that, because there are a lot of things about a vaccine that have to happen for a vaccine to be effective. There are about 100 vaccines that are currently going through trials with many different companies throughout the world. And I should say the same thing about therapeutic treatments. There are lots of treatments that are being investigated. So what does a vaccine do? A vaccine, it makes your body think that it's been infected with the virus. And so your body mounts a defense. And what happens is, when your body is infected with something, it mounts a defense, but then it maintains a memory of that. And these are the antibodies. And so if ever again it meets that virus, the body just triggers all of its defenses and attacks it and eliminates it. So that's what a vaccine does. It sort of gives your body this challenge. Which is a great thing. But in order to get a vaccine, normally we do in animal studies, and we see, does it have some efficacy in animals? And then, is it safe in animals? Then we have to do a trial with humans just to say, does it produce antibodies in humans? This is not even to say, does it produce antibodies at a level that's going to be effective? So we do trials just to see, does it produce antibodies in humans, and does it not cause illness in humans? So does it do something, and does it not cause harm? Then, when we get to the third phase, you actually have to have people who get the vaccine and people who get what we call a placebo, so that you can compare these two groups as to who does and doesn't get illness. And these trials take a great deal of time. So you have to have people who get the vaccine and people who don't get the vaccine. And then you have to let them go out in the population and have normal exposure to the virus. So these things take a lot of time. Will we have a vaccine sometime next year? Everything would have to go perfectly right. Could it happen yes, it could happen. I don't honestly think that most of us think that it is likely that we will have a vaccine within a year. Perhaps a year from now, we may have a vaccine that we feel comfortable going into trials. Now, once you get a vaccine that you think works and has gone through that, then you have to scale up production and distribution. So a vaccine coming along and making some rapid turnaround, it's not something we should plan on. You know, it's just not something you should plan on in the short term. In the short term, we need to do all these preventive measures to keep our cells healthy, to keep the virus from circulating. Now, let's say we get a vaccine, and let's hope that we get a vaccine sometime next year, sometime middle of next year. That would be great. That would be fantastic. We're all hoping for it. But in order for a vaccine to be effective, enough people in the population have to take the vaccine to protect the population. We call it herd immunity or community immunity. I'm sure that people are starting to hear this phrase. So what that means is enough people take the vaccine so that they're protected. And so it means that because so many people in the population are protected, your chances of running into someone who's infectious goes down. So you need a certain number of people to take the vaccine in order to have herd immunity. I want to tell you, for measles vaccination in children, we like 95% coverage. There has to be certainly a high threshold. I think it will, I can't say what it will be for COVID-19 because the vaccines haven't come out. It depends on how effective the vaccine is in general. And then, so how many people do you need to actually take the vaccine? Now, I know that there's a lot of concern about these vaccines. I know that a lot of people say that they don't like their children taking vaccines. They don't want to take vaccines. There's concerns about some of the additives that have been used in vaccines. Some of these vaccines can be a live virus, where actually they will take a snippet of the live virus and use that to stimulate immunity. And sometimes it's called an attenuated virus. They take it and they sort of kill it, but it has enough of the little antigens or it has enough things that your body recognizes that it will cause a response. So there are different types of vaccines. I understand people's fears about vaccines, and I know a lot of this has come out because of autism and vaccination in children. I know that this was about 10 years ago, maybe 20 years ago. A lot of this information came out. A lot of parents didn't want to vaccinate their children. I just want to say that the studies that showed that association have been proven to be incorrectly done. These were poorly designed studies. They were badly analyzed, and they have been withdrawn by scientific journals, and their conclusions have been resoundingly refuted. So there is no link between vaccination and autism. Now, does autism tend to occur in children about the time after they've been vaccinated? About age 2? This is when you start to sort of pick up autism in children. Are we more attuned to autism these days? Of course we are. I mean, it is something that's gotten a lot more attention. But because something happens in sequence doesn't mean that that was the cause of it. So, kids may be vaccinated and then they're at the age where autism would be detected. This doesn't mean vaccination caused autism. It may seem like it, but it's not causality. Like, I walked outside and it started raining. Me walking outside did not cause it to rain. It was just simply a temporal series. I walk outside, it starts raining. It's not cause and effect, which in Buddhism we should understand really well. So I would like for people to not think about that when it comes to vaccination. Vaccinations have saved millions of lives around the world. I want people to think about things like polio and smallpox and yellow fever and measles. just to name some diseases that have been cured by vaccination, if it weren't for vaccines, there would be millions of deaths throughout the world without this. We can look right now and see that measles has exploded around the world. Last year, we had outbreaks of measles in Europe, Ukraine, Africa. And why? Because of a lack of vaccination, you know, and I believe, I want to say 30,000 children in DRC have died of measles in the past 2 years. There have been hundreds of thousands of cases, and all of this is because of a lack of vaccination. So vaccinations are very important. They are very effective. Is there going to be some small population that does have some side effects? Yes, there is going to be some small percentage of people, but the large, vast majority of people, millions of people are going to benefit from this. So I hope that people will remember the big picture about vaccination, especially with the flu season coming up. This is not a time to take chances. If you get a vaccination and you feel a little sick after getting a vaccination, actually that's kind of normal. You know, it's the body thinking that it's infected, and so it gears up. You may get a little bit of a fever, you might have a little pain where you got injected at, but that's normal. So don't let stories like that scare you from getting vaccination. Of course, if you have a severe reaction to a vaccination, call your doctor, your nurse, your pharmacist immediately. But vaccinations are very important, not just for COVID-19, but for the health of children, the health of populations around the world. So there was one last thing I wanted to say. I have now just adopted 2 dogs. And so a lot of people keep asking me about pets. So what about your pets in COVID-19? I know that people have heard about, I think there was a lion at the Bronx Zoo that got COVID-19, and there have been other reports of animals getting COVID-19. We have had outbreaks, strangely enough, we have had outbreaks of COVID-19 in mink farms, I think in the Netherlands. Actually, we tend to give it to animals. So if you have someone in your household who is ill with COVID, they need to stay away from your pet. You need to keep your pets isolated. The odds are that you will give something to your cat or your dog. The chances of your dog or your cat giving it to another human we have not seen this happen yet. So we do tell people, you know, when you walk your dog, keep your dog away from people on the street, because dogs lick and they lick your face. So keep your pet safe, because they can get it and they can get ill. But you don't really need to worry so much that your pet is going to give it to you. Mostly we, sadly enough, give it to other animals. So I'm going to wrap up here, and I'll be happy to take any questions that you have.
Thank you so much.
Thank you so
It is
much.
my pleasure.